At the Leeds teaching hospitals, we aim to put patient safety needs first. The Trust is one of the highest users of blood in the country. Clinical teams may request collection and delivery of blood components for transfusion by Trust porters using the Carps Portering task management system. To ensure the right blood is collected for the right patient and delivered to the correct location, requests made on the Carps system must contain the patient's first and last name, date of birth and unique identity number. In a recent audit, 45% of Carps requests did not contain the required 3 patient identifiers. The aim of this short film is to demonstrate to staff the correct way to request porters to collect blood from blood bank using the Carps system. We work very hard to ensure right blood, right patient. Part of this includes the importance of ensuring the correct blood is collected. At St James's, Chapel Allerton and Wharfdale hospitals there is an open blood bank system. This means that all red cells required by any patient at these hospital sites are within the relevant blood fridge at the same time. There will be more than 1 patient red cells being stored at any one time. To help porters select the right blood for the right patient, they must be given the patient's first and last name, date of birth and NHS number so they can find the correct patient's red cells from the choice of numerous red cells within the blood fridge at any one time. To help porters select the right blood for the right patient, it is vital to enter the correct information onto the Carps request. It is important to remember that failure to follow this correct practice could result in the wrong blood being collected and delivered and therefore increase the risk of transfusing the wrong blood, which in the worst case scenario could be fatal. This is how to correctly enter a Carps request for blood collection and delivery. The staff member is making a Carps request for a porter to collect red cells. Patient movement is then chosen, followed by entering the location in the Booked By section. Indicate what is required for collection, for example, blood. Then choose from the drop-down menu from where the blood components are to be collected, for example, transfusion, Bexley wing. Indicate where the blood is to be delivered, for example, your ward location. In the comments field, type the intended patient's correctly spelt first and last name. It is vital to ensure the correctly spelt first and last names are entered to help porters to distinguish between other patients with the same name. The first and last name must be followed by the patient's correct date of birth and NHS number. The number and type of blood components should be entered, for example, 1 unit of red cells. Select the urgency or task priority of the request. Urgent must only be selected if the patient's condition would deteriorate without immediate transfusion. Normal should be selected for a routine red cell collection. Date and time of the collection and delivery may be selected following this if the collection is required sometime later in the day. Otherwise, leave this field as it is currently set for collection of blood in the near future. The Carps request should look like this before it is entered or sent. Remember, upon delivery, it is the responsibility of a qualified member of staff to take the blood components from the porter and to check the correct blood has been delivered.